Nice evening, everyone. It is March 9th, 2026. This is the Board of Health in the town of Fairfield. It is 7:35, and we'll call the meeting to order. First, we have last month's meeting minutes.
So I'm going to make a request to table the minutes till next month, or ask for a motion to table, I guess. I think that has to be seconded. Or somebody would have to make it. I can't make it.
Okay,
I'll make a motion to table.
I'll second it.
All right.
Any conversation on that?
Yeah.
I was out sick. I had a bad cold Thursday through Sunday, and so I didn't get a chance to look at them before they were sent out, and I picked up a few things that I want to change.
All right.
Wonderful.
Any opposition to that?
No.
All right, hearing none, that carries. Thank you. Let's move into our report. Sam?
Sure. So the health department is peripherally involved in an enforcement action related to the Reef Shack. Rob Guerrera and myself participated in a few meetings with various town entities, police, First Selectman's office, and zoning, and health, and fire. What is happening there is the Reef Shack, which is on Reef Road. It used to be the old 7-Eleven.
Yeah.
Has somewhat turned into like a nightclub, is operating like a nightclub, and they had their liquor permit revoked. And so it's now like a bring your own type of thing. And so, there's just a lot of activity. Fire has cited them for overcrowding in there, and so it's in a lot of people's opinion, an unsafe situation. So we've sat in a few meetings related to that, and then met with the town attorney and a few others to talk about enforcement pathways of like what is the predominant violation. And so just today an order was issued by planning and zoning, and basically it's just stating that they're known to be a table service restaurant, and they're not operating as that. And so that'll be the enforcement path that it goes down that path down. There really wasn't any kind of health code violation that we could cite. It really wasn't appropriate for us to go down that path, but it was a fair amount of time in the last couple of weeks responding to that. In addition, we've been involved in a pretty significant hoarding case that's taken a while, but we're able to get the occupant owner to take action. So we had an initial decluttering effort, and we got her to hire one of the junk hauling companies, and come in and remove a lot of stuff and make safe pathways, and then we're able to do some initial through the building superintendent or building super to get some rodent traps and things in there, and then also the following week following Monday we went in again. That was on a Friday with that, and then the following Monday we went in again with a pest control operator, professional one, and then he placed additional traps and glue boards and bait, and so trying to get that situation under control. And so it's moving forward. We're getting good cooperation. It's just a lot of parties involved. Social work is involved. Social work department is involved, and others trying to make this happen as efficiently as possible and quickly as possible to resolve the issues there. The health department will be in a few days launching our new database. So lots of us have been, 12 or 13 courses assigned to us to do prior to this, and then we have 4 training sessions this week, and then we'll launch that new database. So we're hopeful it'll go smoothly. We really don't know. We'll be doing double data entry for a bit, until then. But so we'll be testing out, iPads in the field and that kind of thing. So the program is called Municity. It'll have an online, a public portal that people can complete permits through the public portal. and look up information. We're currently using it now to look up, we have all of our septic system as-built and permits and everything digitized, and we're currently using it. People can search for septic systems that way in Municity now. And we're currently approving like building permits through the system, but now the health department will go live within a few days, and so I'm thinking of putting in my retirement notice,
So people will be able to like look at, restaurant evaluations and things like that through there to see the ratings?
Eventually, that's what we've been told, that, eventually we're going to just get functional with doing field-based inspections and entering data in the field on iPads and printing out licenses and sending them out, emailing licenses out or applications out. And so that'll be the initial phase, but we're told that, yes, people will be able to go in and pull up a PDF of the restaurant inspection or a view of the inspection report. And so that's moving forward. It's been 3 years that we've been working on this, so we'll see. We continue to work on 2 overcrowding cases, one in the beach area, one in the Sacred Heart area, with our legal town attorney trying to resolve that. A lot of delays there with, the people have requested continuances, trying to stretch things out, and people are trying to get to the end of the year. So we've, said no, but the parties that at the other side can overrule us and grant the extension. So that's what's going on. We have another case regarding a failing septic system that we're just about to submit an arrest warrant application for. Just an individual who's not doing the repairs. We've issued an order, we've given extensions, and they're just not doing it. So we'll be moving forward with that probably this week. We did present to the Board of Selectmen our budget, and they did approve it with we proposed combining up 2 part-time positions into 1 full-time nursing position, and that carried forward. We presented to the Board of Finance last Thursday night, and there really wasn't much in the way of questioning related to that request. A few questions about other aspects of our budget, just some of the salary line items increased in a significant way related to including multiple years of increases. So it appeared to be a big jump in dollars for full-time payroll, but it's really just multiple years of increases being rolled into 1 year, as explained to me. I don't really, in the budget process, we don't do the payroll line items. That's taken care of by the finance department. So, but I did see that and question it and went upstairs, and that's what prior to that, to make sure I had a good answer for that. So we'll wait and see. We have a couple requests from the Board of Finance of information that we have to provide to them in terms of an org chart and some a fee study to see if our fees are consistent with area towns. So with Andrea's help, we did that today, and of 26 different fees that we have, 19 of ours are higher than our neighbors, with six of ours being lower. All in all, if you look at, if someone was to take out one of every permit in our town versus the average for other towns, it is higher. So it's so our fees, I think, are consistent with other towns, or at least near the average. I'm trying to put in a median into the chart now to see how does it do with that. So we'll present that to the Board of Finance prior to the next vote meeting. So we continue to participate in the CDC calls where they continue to talk about the South Carolina measles outbreak going on, and interestingly, they had a long session about FIFA World Cup preparations that they're doing in terms of understanding the impacts of all these other, not just the athletes coming, but all the other population and fans coming from all over the world, and that each team is setting up a base camp. So like at, one of the teams, like I think Senegal will be at Rutgers, and, that's where they'll be their base of operations for the time that they're here, and so we're looking at that. I did search the known base camps, and there's none in Fairfield. Fairfield U and Sacred Heart were potentials, but they are not at this point. They said, the announcements are coming up, fast and furious. But interesting to think about the impacts of all that and all the fans coming in, and the potential for infectious disease that come with them. We did have both U.S. Region 1, which is like most of New England, and National Medical Reserve Corps calls this past week, hearing from the Assistant Secretary of HHS Preparedness, if I'm saying it right, but so just to talk about the sort of future of the MRC program and the current status in terms of budget and all that. And so everything seems to be level at this point. So we don't expect any big impacts, but we don't expect, as was in the past couple of years, no large increases or new grant programs. They had a couple different grant programs, which we applied for and received, but nothing like that on the horizon. And tomorrow, Santina will be at the Connecticut Public Health Association presenting on, she submitted an abstract to present, and so it's on our joint regional vaccination campaign that we did with, Norwalk and Darien and Stratford and Westport, a few others. We hired a consultant with the federal dollars, the federal immunization dollars. And so for Heart Month, we did have Know Your Numbers screenings during the month, and we had 22 individuals screened for cholesterol, blood pressure, A1C, height, weight, waist, so they get a picture of all their numbers and know how to track them, and teaching them how to track them and be aware of what they should be watching for. We had the hands-only CPR challenge for the month. And so, and we started it here, and then we spread it to all the local health departments. And so we did have 932 individuals watch the training video, with 611 of those being people who had seen it for the first time. We had people from 108 different Connecticut towns complete it, and people who live in the jurisdictions of 53 out of 59 health departments. So we were trying for all the towns, trying for all the health department jurisdictions, but we didn't quite reach it.
Great, cool.
But
numbers.
It's good. 932 people, watched the video and got either a little first time or got a little refresher on hands-only CPR. This past month, the nursing program, public health nurse did 30 vaccinations for children, with 2 of those being homebound individuals. And we will be having Matter of Balance classes coming up in April and May at the Senior Center. April 8th, we have a Save a Life Narcan training that we organized at the Fairfield Main Library in the evening. And then for Mental Health Awareness Month in May, we'll be offering 2 QPR suicide prevention training programs, a Question, Persuade, Refer program. And then I thought I would show quickly some of the what's going on. So, the Measles cases, this is last year's outbreak, and this is what's going on now, in South Carolina, kind of leveled out a little bit over here.
This is US though, this is the whole,
Yes,
or is this just South Carolina?
this is all of US, so this
Okay.
is sort of, but the predominant number of cases
Yeah,
here
our county
is
is South Carolina.
South Carolina, this is the Texas,
Yeah.
Oklahoma, New Mexico, and so it's, it's still there, still present. We're, so far we have, cases, we're 2 full months in, and we've got 1,281 cases already, compared to last year, we had 2,283. So we're more than 2 full months, and we're more than 50% of the way there. So it's looking like we'll have another challenging year. And so, but then I wanted to show you how we're doing here. Let me just drag this over here where it's a little bit easier to see. So you can see, like, influenza has relatively peaked, but you see a little increase going on here. Same thing down here by week. These are hospitalizations. These are ER visits. If you look at influenza, you can see it's coming down, but you'll see here in the dark, the B is increasing. That's causing the sort of peak that we're experiencing now. RSV is still high, still going up. And you'll see over here, we've got in February 4 RSV deaths. Even 10 to 19, and then some older individuals as well. 8 deaths in the last year. This goes back a year with, half of those being in the last month. COVID, it's coming down, but it's still present, still going on. I think we already kind of looked at this. And looking at wastewater for COVID-19, we're seeing, while hospitalizations are down, which is good, this is the dotted line is hospitalizations for COVID-19, we're seeing things trending downward, which is good. And then I thought I would show you one other new resource that I was given access to for our wastewater treatment plant is a company called BioBot that does testing, and so we have access to some different tests that are available. Now, not all of these, like the measles test was conducted for like 5 months and then they stopped, and so I think it's related to different funding sources. But I did download a couple of them to say, we can show here. So here's 3.3 and 2.24 influenza, and you can see, like, in the last 2 sampling dates, A was not detected, where influenza B was quantifiable. But then prior to that, for a good while, A and B were mostly quantifiable. So you can see what's reflected in the charts at the state is kind of what's going on here individually in the town as well. And then something I thought it's sadly interesting to see. This is
The drugs.
all substances, and so just to see what's being picked up, just on this one sampling date, 2/24, you can see, fentanyl, carfentanil, cocaine, fentanyl, heroin, like all these ketamine ones that are just, we know are just illegal, and, naloxone, so people are overdosing and using naloxone. So it's,
This is just aggregate town.
This
Right.
is, yeah,
One day testing in the town of Fairfield,
what's picked up at the water,
and all of those that are present.
yeah,
Crazy.
yeah. So it's,
The fentanyl is pretty scary.
yeah,
I've heard a lot about xylazine too, that's been in a lot of the current drug trends.
yeah.
Stuff I've heard lately.
Yeah, so it's, you know, it's, I think this supports our work that we, and our efforts that we have to continue to work towards, doing our best to educate people. And we are, working with the First Selectman's Office on the opioid settlement funds to try and put a mini grant type of program in place to sort of reach out to those providing services to this population to try and do education and treatment and try to address this issue. But it's to me, it's like says, yeah, it's still an issue here,
Yeah.
clearly. So interesting data.
Would there be, an opportunity for y'all to do another naloxone, like a Narcan training in the fall?
Yeah, we do, we typically organize, a few throughout the years, and we're not the only ones doing it. Fairfield Cares does them, the Catalyst does them, and you do it for all the nurses.
Yeah.
So every school has Narcan, and nurses are all trained.
Do you distribute the intranasal cartridges when you do the training so that they can take them home with them?
The ones that we organize, yes. So we, like with this one, we're having Catalyst come and do it at the main library, and they have
They
grant
have a
funds.
very good kit. They
Yeah,
give
they
out.
do, even with the
Yeah.
test strip.
It's got like
Oh,
4
cool.
doses in it, I
Oh, great.
think, 2, each one is an individual.
Yeah.
And she does a good job, the woman who does them. She does a lot of, I think she covers a lot. They're also now, Catalyst CT are really pushing the, cabinet.
Yeah, we just talked about it, the Narcan cabinet.
It's tricky because someone's got to store it, stock them, and make sure nothing's expired.
And also make sure that everybody knows that it's there.
Yeah, but it's happening more and more in communities where I work, and the opioid settlement money is a great use for that.
Yeah,
Yeah, and I think,
we just talked about it, yeah.
we talked about it, and I think we're willing to serve as that location, so it's just a matter of,
Yeah.
I think we can put that in our little lobby there and take that on, so.
Yeah,
But,
They'd like to get them in all the schools, that's harder sell.
but they could do one at Parks and Rec, they could do
Yeah.
one at Bigelow, like there's some, yeah, they could do it in the pavilion, yeah, that's a great idea, both of them. Pavilion at Mohegan Sun, like wherever there's staff, that the town employees, that they could kind of watch it.
yep. So that is my report.
Thank you.
This is great, though, this
Yeah,
dashboard.
yeah,
That's awesome.
yeah, no, it's interesting. It's, to look at, and some of them, the data's doesn't exist, or it's expired, or it's old, but there's a few there that are, have interesting data to support the work that we do.
Yeah.
Now, we're not the most rural community, for sure. But with the Rural Health Transformation Grant of, $154 million, whatever it was, to Connecticut, is there any ability for any of that money to come to Fairfield to improve the efforts here? I haven't gone through, every detail of the grant application to see what might apply here, but I was wondering if maybe you already have.
I remember seeing a NOFO, a Notice of Funding Opportunity, and my recollection is I looked at it and said, we don't qualify, I think it had to do with affluence of the community, but.
Was there maybe there's larger projects that could encompass the entire state that maybe we could get interwoven into, anything like that?
Yeah. Yeah, potentially. Yeah, I haven't seen anything recently coming out related to that. I remember seeing something about that and checking to see if we meet the definition, and I seem to recall saying, oh, no. It's a lot of grants like that where we're not the primary target. So,
Thank you. Any other questions for Sam?
No.
All right, thanks for your report.
sure.
Sarah?
My next. So in the nursing department, the best thing is that we remain fully staffed. It's been a nice, calm year. I actually have several part-time people that would love to go full-time, several subs that would love to, work part-time or full-time. I've been working for the last year and a half, really trying to build that sort of pipeline, especially with sub-nurses. It's a real balance between, we have somebody out every day. We could have one sub working every day, but we need, more, in case there's people that are out and whatever. So we've really been working on that and looking at staffing. I have some interesting numbers I'm not presenting now. I'm going to wait to the end of the year. But the nurses, we keep statistics, and then we also keep track of number of visits. Is up everywhere. The nurses are well used, and, we know increasing chronic conditions, mental health, all the other stuff that drives kids into nurses. But I've been trying to play around and really get, there's visits, and then there's also all these other things that we do, and trying to quantify those and measure those. AI really helps you run numbers and put things in and look at places that have 2 nurses. It was weird because the numbers were down everywhere in February, and I was like, what in the world? But they only have 13 days of school. So even all that out, you can,
It felt like that.
so many snow days. Yeah, as a parent. Yeah, so been working a lot of that, looking at staffing and planning, for next year. And case management is a huge part of what all the school nurses do. We do have part-time nurses in different positions, and we've used them different ways over the years, but in some places where we have it, staffed with 2 nurses every day, but it's a combination of full and part. From a case management perspective, it's better to have, not like sort of a charge nurse and 2 part-time nurse situation, but really 2 full-time people who divide how they manage all of the kids. We actually just trained a couple new subs because we've had such a big need for subs this year. We usually try to wait until the beginning of next year, but overall I feel really good about staffing, really happy. We're chugging along. The other thing that I've been working on for a while is building up sort of our continuing education for school nurses. The historical, you take a day off and go to a conference is great, but times 40 nurses, and conferences are in an hour away Connecticut, and parts of it are super relevant, and parts of it you're, missing. So we purchased this package of courses that's called NAUSHA. It's Northeastern University School Health, and they do really good continuing ed that are broken down 30 minutes to they have a 4-hour one, literally 4 hours about doing vision screenings, which
You gotta
Wow.
commit to
it's
that.
a long time when we have these spot visions that do it for you really, really quickly. And so I've created a package of sort of what new nurses have to do on top of the training that we provide, what I want everyone to do, and then allowed some flexibility. I've gotten such good feedback on this program. From nurses who've been school nurses here for 20 plus years, who are like, oh, I watched the abdominal assessment one and I love, whatever. There's some that are not as good. We've been trying to keep track of which ones we really like, and do we need the full 10 for next year. Amazingly, Connecticut is one of very few states that doesn't require nurses to show proof of continuing education. There's a new it's like Connecticut and Alabama, Kentucky. It's a surprising. We're in a sea of required continuing ed. But I feel strongly about continuing ed. It's always something really important to me. I'm a nationally certified school nurse, and nurses have the ability to get reimbursed for that. I think being involved in your professional organization is always great. So I have a lot of nurses studying for that right now, and the continuing ed, it helps, works both ways. Speaking of that, I think, did I already update? I accepted a position, so I'm the technology chair, which my children love, for the Association of School Nurses in Connecticut, starting this month. I'm the least tech of my very tech family, but I'm tech enough for this, I guess.
They're like, wait a minute.
Yeah. Well, that's what I said. I'm I just need, my daughter and some Canva, and I can do, yeah.
They can do so much with Canva.
I know. I have, my husband's entire career is in IT, my daughter's studying engineering, my son is too, but I'm the tech chair for the Association of School Nurses in Connecticut. But I really been, and I wasn't sure how it would go, because it's kind of new to require this. School nurses are supposed to do 15 hours of continuing ed every 2 years. You don't have to show proof of it. It's really for your employer to keep track of. I added it onto annual evaluations this year, so everyone's listing what they've done, and we're keeping track, and we're getting, really good feedback. I've been really, really happy with how much the nurses have enjoyed adding continuing ed to their busy days. You can do it when there's early dismissals, but also these are so nice, you can pause and restart, and, we're not asking everyone to do them on their own, though some people have loved them to the point they've done a lot of them on their own. I think you did all of the updates I was thinking about doing for Julie, the Know Your Numbers. Today we did the Know Your Numbers makeup because of snow for the town employees. She had a really good turnout for that also. Gosh, I thought I had a third. And then we already are looking at planning for next year. This is sort of this wonderful lull of the year where, I shouldn't call it a lull because the nurses are busy, but you know your students, you know what you've got going on, your staffing set, all of that, and trying to really develop what we're going to do for next year and some of that planning and looking at what policies I really want to look over. Still get to talk about life, but a lot less with the policy that we had this year. So I'm trying to look at those things that we can, roll out and have ready to start for next year, which is one of the ones that I've got on to talk about today. I think that's it in terms of a report of what's going on. If you have questions?
You should probably talk about what's coming up that we don't have it tonight, but what you're probably going to be bringing to the board next month.
Oh, you want me to talk about?
Yeah, but you talk about that in your report.
Oh, okay.
Not the one that's on the agenda.
Not the one that's on the agenda, but the other one.
Yeah.
I had one of the school nurses call me. She was kind of excited because it had been a donation of a whole bunch of coloring books and stickers and nurse pads, and they were all heavily branded by a new urgent care going into town. Made me bring up the conversation with Sands to just be like, do we have a policy or a rule against not, even the nurse passes made me kind of nervous because if you hand them out to the teacher and the teacher writes to the nurse and it ends up in the kid's backpack, and now it's like we're sort of endorsing one particular practice and where to take your child, and always we would be endorsing your pediatrician, so whoever that may be. I felt bad because, she wanted to they were meant to be packaged and then handed out to the kids, and they said I am a healthy hero with the urgent care facility and that sort of thing. So when I talked to Sands about it, he said, yeah, take a stab at putting together a policy. Santina and I worked on it together, and then Sands threw all sorts of monkeys in the wrench, being what about if we're handing out bottles of Dasani? Are we branding, that we want this bottle? How to write the policy to be generic enough? What about a poster that's stop smoking from the, whatever, American Lung Association? Are we branding that? And my thought is to sort of whittle down the wording to where we're making it really clear that it's to give the appearance of promoting provider good service until Neffy came out, that donated epinephrine to schools everywhere with EpiPen, and we have those, labels and stickers on things. That branding it. Yeah. So I guess we're just sort of.
What if you get a grant from Target or something? And then you've got to put the bullseye
on something. Yeah. So I think we wanted, before we spend any more time going round and round with the wording of it, to hear what people thought. What I don't know, you guys, other places have. I was trying to think in my previous district, I would have said, oh, for sure, we had a policy. Did we, or did we have a rule? We definitely couldn't hand out branded stuff. And obviously, I can deliver that message to all the nurses. If you happen to get something like this, check with me first, before. I was kind of surprised, actually, how much stuff this practice sent to an elementary school,
And just one. They just sent it to one?
That's only one told me about it. I haven't opened.
Near where it's going to be opened? Is that maybe location?
Yeah, it is near, but there's other one there, too.
So I guess, we're kind of looking for a sense of the body, not necessarily a vote. We'll eventually when we work out the policy, we'll bring it, but we want to kind of get your input on it. We think we shouldn't be promoting one entity over the other. It seems pretty obvious. We don't do that, we don't put out, hey, this is the really good restaurant.
Right.
We put out, here's our favorite septic system installer,
Yeah.
It's we don't recommend.
You said even with the hoarders, with the removal of the stuff, that there's companies.
We don't recommend any particular service. Yeah. You can, look them up in the yellow pages.
So I think you just keep with that, right?
Like an informal.
Yeah, we don't recommend any particular service. To me, the coloring books is different from, EpiPen.
Right.
Like that.
Well, that's what we
And the
really,
water bottles are different than the nursing.
right, that's where we
Very
really got
different.
into the weeds with the
I
wording.
don't think you need to get, I think the food with like, so you give out snacks at something or water, like that's very different than a piece of paper with like instructions that has this endorsement on it.
Yeah.
I mean, they're two very different things.
Yeah, I mean, I think if it's, first of all, I don't envy your task in trying to craft language here, because this is hard.
Yeah.
You know, I think when there's not a competitor in the market, it's sort of less of an issue, right?
Right.
Like, Nike doesn't have a competitor right now.
Yeah.
You know, EpiPen does, because it's generics, right? But if they were to come in and say, we're gonna give you a grant for something, but you gotta put our name on the poster or whatever, you're gonna turn that down? So
Right.
you do have to provide for that. At the same time, I think about like an event we had at our school last year. We had a fire safety event, and we had Hartford there, and we had Yale there, and they had their coloring books and other things with their stuff on there. And while it's not the health department giving it out, it's still, you know, a public school entity now that has, you know, some health organization there giving things out. Granted, you've given equal opportunity by inviting them all,
Mhm.
but how do you provide for that in the policy as well, right? Because it's still on the school grounds, and
Yeah.
that's hard. I
My
don't
advice is
know.
always to see what other people are doing.
Yeah.
Yeah, we
Call.
tried that too, so
Yeah.
I think maybe Stratford had a policy that they were, I mean, this isn't, like he said, it's not ready for
Right.
review or.
Yeah.
There were some that had a policy, there were some that said it's a unspoken rule, you know, a lot of school nurses are through boards of eds, there are boards of eds that have policies against it, and it's more like to your
Okay.
point, where they try to open up, you know.
If it's like a specific event where it's gonna be sponsored, like I feel like something like that is easier to get away with if it's, you know, just outright marketing yourself in a school by having,
Yeah.
you know, the whole hoard of supplies you're gonna give to your kids. No, obviously not, you
Yeah.
know, I think we all common sense agree on that, how do you language that out? That's the
Yeah.
hard part, but I think the concept is there, you know?
I mean, you say obviously not, but when my first response was like, oh, no, we can't use those stickers, we can't whatever, and there were two nurses working at the school, and they were like, oh gosh, I never even thought of it. So I was like, we do need some sort of messaging, whether it's just me sending, you know, an email or saying at the next staff meeting or just tomorrow.
And we don't want to shoot ourselves in the foot, you know, like
Yeah.
if we buy, you know, like I used the example, if we buy a particular brand of Band-Aid and on the back of the Band-Aid is the name of the Band-Aid,
Yeah.
well, our, you know, like the policy was saying, you know, no branded items, so like,
Right,
like if we buy stuff for us to use,
Well-
give it out, we're not like promoting
Right, you
that.
buy more medical and it's
I
got the
think
logo on it.
it's more in like donated goods.
Yeah.
well, yeah.
Right.
Then we went down that, is it
Yeah.
the donated things that are the issue, is it versus what we've already purchased, so then we've approved those things, and
So,
I think that's where you wanted us to
I think also
start.
there's like one thing about like a swag table where people select what they want,
Yeah.
and then you stuffing a backpack with
Yeah.
coloring books
Yeah.
like that.
yeah, I mean, it's,
And a company distributing their own goods versus.
What if you have like a health safety event at school one day, you
Yeah.
know?
You could lay them
All
out
that
and
stuff
then-
could be
Yeah,
picked up.
it's
if
tough
people
to, I mean, they were,
want.
you know, cute little nurse passes, and it's a pain to make nurse passes, and there were thousands of these nurse passes meant to, but,
I get it.
yeah.
They have that urgent care is good marketing.
Yeah.
can we get a Fairfield Health Department sticker and put them over?
I was even looking, could you cut them? I
Yeah.
mean, it feels so, like, last thing we need is more stuff in a
When-
landfill.
When, Art Leffert, my former boss, retired, we had stationery, lots of it, with his name, you know, Arthur Leffert, Director of Health, you know, and so we looked at it and we said, all right, we send it to the printer, and they cut
Oh,
the sides off, and we made notepads.
yeah.
You know, like smaller, like notepads out of all of them, you know, so
Yeah.
like, we're able to do that, you know.
Well, and like there were ice packs that, you know, reusable ones, and I was like,
They're so great.
and if they're in the nurse's office, is it the same? I just don't want
Sure.
those going home with somebody, and then it's like, oh, they hit their head, now they brought this home, and the,
See, and I
No.
would view that as different, like if
Yeah,
it's, if it's,
that's
if it's
what
something
I-
we have and we put it on them, you know,
That's
we're
sort
not
of what I
giving
was
it to
We
them.
got a
thinking.
donation and we're.
yeah.
Right, like I feel like a Band-Aid or an ice pack is different than like, here's like, I don't know.
The healthy hero. whatever,
Yeah.
Yeah. So,
We'll
Good
have
luck.
fun with that.
Good luck.
thank you
Good luck.
thank you for adding to the muddiness.
But what I'm hearing everybody say is, what's coming up again and again, is that if it's serving a purpose for that child.
Yeah.
Yeah.
That is different from
Yeah.
like
Like
a
a
coloring book.
Band-Aid.
Yeah.
And we'd written in sort of like, a need for approval, you know, to check first, like you get, you know, a whole bunch of stop smoking posters, you check with us, we say, you know,
Yeah,
said
maybe
sure,
it's
you
just
know.
a check-in
typical,
policy,
Yeah,
like,
which-
we are the final approvers of
Right.
materials that are
Mhm.
branded.
Yeah.
That are going up.
Sam felt strongly about the donated part, and then Santine and I went round and round about it, but it is different versus something that we purchase,
Yeah,
and then
yeah.
somebody just gives to you, and
Because then
maybe
you
that.
can price compare.
Yeah.
And then you can say, well, this was the least expensive.
Yeah,
All right,
I
so
mean,
I'll
and
Perfect
donated,
set of words.
you know, donated promotional material from
Uh-huh.
the American Heart Association is different
It's
than
Yeah.
a private business,
Sure.
you know,
Yeah.
and so it's, we don't wanna restrict ourselves or be in violation of our
Yeah.
own policy, you know.
Right,
So-
even the Narcan cabinets that we were talking about,
Sure,
I
our
mean,
brand.
we try to call them naloxone, you
I
know, but
know.
they all
Harder.
say Narcan.
And it's
they-
not even Narcan anymore that they're giving out, because I guess now it's this other brand
Yeah.
that, I don't even know what it is.
I
The
think they're,
Narcan's just Kleenex to everybody, right?
they're Band-Aids,
Narcan,
it's not,
yeah.
like Band-Aids, not,
Yeah.
bandage.
Narcan isn't even what they're putting in stuff, they're not, the state's not getting Narcan, they're getting something else.
Okay,
I haven't
Okay,
heard that.
good luck.
yeah, good luck, okay, great.
All right, that's the end of your report?
I guess
All
so.
right. Any correspondence?
Muddy water.
None? Oh, actually, we did get the one, I think you guys all received it, there was a complaint to the Board of Health. You didn't get it? Okay, it had the BOH at Fairfield CT in my thing, but it was about,
Yeah.
yeah, it was, I'll have to look into that if you didn't get it. A complaint about, bed bugs at a senior housing facility, so we've checked in on it. The housing facility has hired pest control operators and are implementing a plan there. And so, but that was the only communication directed to the Board of Health, I think, that I got.
I
So-
got it too.
So are we supposed to get those emails when they come to that general?
There is a general, you know, so if you go on the Board of Health webpage, there's a button that says to email all members of the Board of Health, and it's supposed to reach all of you. And so I'll have to check with IT, that you didn't receive it, because you should have.
And I have to make sure they have everyone's email, because I have the list.
Yeah.
Any others?
No?
Any old business?
None?
And we do have new business. Back to Sarah.
Back to me. So this summer when I sat with Dr. McDonald and we reviewed all of our standing orders that we do every year, the school health standing orders, school nurses can't do anything without doctor's orders, right? So everything from gargling with salt water to Narcan. And we have standing orders for flu vaccine, COVID, all the ones that we administer. Signed them all off, distributed them, didn't think anything of it, and then I went to pull it out again to talk to Dr. McDonald. The Instaglucose dose that's in our standing orders, what's commonly packaged is slightly different, so I wanted to talk to him about making a change in that. And I realized that it was approved by the Board of Health, which at most years it had been done. I did not do it last summer. It didn't even cross my mind that the clinical decisions would be approved by the Board of Health. I was originally going to make all the changes to the Instaglucose part and bring it here, and then sort of thought about it more and wondered if what we really need is a policy that says that there are standing orders and that we review them annually, and that the nurses operate under the discretion of the medical director, and then separate standing orders that just give me a little more flexibility. I mean, I can't do anything, again, lowly nurse, but to talk with Dr. McDonald, if I do want to make changes, even like the brand of Save a Tooth is in there, which is really expensive, and I've been looking at, do we even need that? Would they just expire every year? And so taking those clinical decisions out of the Board of Health oversight and then leaving a policy that really is for the Board of Health to say that there are standing orders that are reviewed at least annually. Does that all make sense? You're all medical people nodding at me, yeah.
I think that sounds totally fine.
Yeah, I didn't even, I feel kind of bad, because I was like, oh my gosh, I didn't even bring this last summer. I mean, I certainly sat with Bruce, and we went through them all and, signed all the standing orders. There's no Board of Health oversight for flu vaccine or RSV, other than general, that there are standing orders, so. Yeah. Does that make sense? You have questions? You have
It'll be in
emailed
your review this year.
that I didn't do it.
Yeah.
And honestly, Jill left me this calendar, and it's been really, really helpful of like big things to like, start thinking about ordering EpiPens in February. And there was nothing in there about it, and it never would cross my mind, for the clinic.
Glucose.
Well, yeah, but even just, of course, you review standing orders, but I didn't think of here. So did you guys all get the copy? I made copies
it
in
was,
case.
it was in the email.
Yeah, and other than the fact I used the word I think I wrote in my description, I called myself school nursing supervisor, but yeah, down here. I should take that word school out, and town of Fairfield nursing supervisor. But otherwise,
I mean, I guess I have
go ahead.
some clinical
Yeah,
questions about some of these, right? And maybe I'm reaching a little too far here, right? But I look at Epi, for example.
the standing orders themselves.
And this one is really, I mean, it's written for students with known allergies.
Yes,
Yeah.
agree.
So, I mean,
So we have a separate
Is that a
Epi
separate
that's
policy?
unknown, well,
Okay.
standing order.
okay,
That's everybody uses the same one, that even Epinephrine, that they even give to you when you order Epi for the school, that's the Epi for the unknown. But this one, it is like I don't love some of the wording in it, so there's other parts that I wanted to really sit down and dig through the clinical part with Dr. McDonald, but happy to hear any other things that jump out to you.
most importantly, I mean, there is an ability for a school nurse to recognize this is anaphylaxis, whether you have known allergy or not, I'm going to give you an EpiPen.
Yeah.
Okay.
And that's been a Connecticut law that was written to
Right.
put that into place. And when Narcan came around, there was a lot of conversation about how to write those standing orders because the way Epi to the unknown is written, it's for students and the Narcan is for anyone on the premise. Most of the time school nurses can't really do anything. I mean, we're nurses, if somebody's in front of you, we're helping, but in terms of standing orders, albuterol for a kid in respiratory distress is different than, a person
Well, and that's what was
who's not.
interesting, because, I mean, the albuterol is written for any kid that's in distress, and you can give that.
Yeah.
But the Epi wasn't written in that way, that's wait a minute, what's going on?
Yeah.
Certainly, I mean, an EMT from AMR is going to show up with far less experience and training than the nurse, they're not knocking them, but they can just get the EpiPen.
Yeah.
Right, and they can make that clinical decision, why can't our nurses make that decision? That's what I was concerned with.
And so there's a separate one, but I
That's
agree
fine
with
with
you,
that.
there should just be one. I mean,
Yeah.
it's really, there's anaphylaxis happening in front of you, we want to
Right.
administer it, yeah.
Yeah.
That would have been on my list of ones to come and talk to you guys about, because, the other is save a tooth,
I laughed when I saw that one.
it's really expensive. It's times 25 emergency bags. We've never used it. I looked back, so they've just expired for years and years. And if you look on the American Dentistry, blah, 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 they say it can be put in the child's own saliva, a pocket in your mouth, saline, milk, all sorts of, things in the rare case that it happens, but we buy these expensive.
Is it still best practice? I mean, is that?
I asked around for other nursing supervisors. We use it in Greenwich. That was it. Everybody else has
I've gotten rid of it.
yeah, they have sort of protocols of what you would do. In best case scenario, is you put it in a glass of milk that you get from the cafeteria. Next best is
Probably,
saline. Next best is they put it in their own mouth. And yeah. Yeah. We actually had a child who had a tooth out this year, and the Save-A-Tooth wasn't even used, and they re-implanted it, and they put it in the mouth. But yeah, some of those things but even we don't use Caladrill anymore because what's cheaper on school health is this generic, Calamine Clear, so some of that stuff, there's a little bit of nuance in here,
But the idea is to
take
seek approval for this sort of clean copy without all the specific directions, and have the specific directions be editable without board approval.
On the standing order.
Yeah.
Based on the, review with the medical director.
Yeah. We can't do anything without Dr. McDonald signing off on it, or whoever, whatever the.
So to kind of correct all those things.
Yeah.
Have that be a separate document so the nurses will still have directions on the things they can do, and that a similar document will be provided to the nurses, and they'll be trained on that when New Year's comes.
And every year, yeah.
And so,
And we ended up having to order that Instaglucose at that higher dose, just because by the time they come here and get it, the ones that were expiring, the rest don't expire till July. So I'm not really planning on making big changes to the standing orders now. It'll be Bruce and I just talked about meeting in April and kind of picking through and going, and then reformatting it in a quicker, easier to read way. Does that make sense?
Yes.
Thank you, I'm
Yes.
glad I explained it well.
Yes, you did.
My other one is actually just on the albuterol.
Yeah.
I'm glad there's 4 puffs on there because so often it's that garbage 2 puffs that get ordered.
Well, Dr. McDowell has strong feelings on the respiratory distress and what criteria is the nurse using to determine that we're using albuterol on a child at all, and, you know, some of that. So he wanted some of that changed.
Yeah, so I love that it's 4, I mean, even upwards of 8, but,
Keep puffing away while we're,
yeah, that's, I think, 20 minutes. Like, that 20-minute barrier, I think
Oh,
is
yeah.
huge. Like, that's a long time.
yeah. Well, you sound like a good person for me to send him by when I'm talking with him, so happy to get your clinical, happy to get clinical oversight. It's just that from my
Don't
understanding.
want to overstep at all.
From a Board
but
of Health,
I'm
you
just thinking
know.
like a nurse can certainly make a decision that, okay, this kid is still in distress,
Yeah,
you know, and either get 4 more puffs while you're waiting for EMS to show up, which thankfully in Fairfield will come in 4 or 5 minutes.
yeah.
Still, they're just gonna get the
I
same
think
treatment.
it had
you know.
something in there about a spacer too, and I
Yeah.
wanted,
Do you have spacers? Oh, you have to have spacers.
we of course have to have
Okay.
spacers, but yes, not the mask though. I don't, right.
Sometimes the mask, younger kids really need the mask, especially like toddler age. Once they're in like kindergarten, 1st grade, they could probably manage to put their mouth on it, but great to
Yeah.
have it if you could.
Well, and then once they put their mouth on them, you know, they're done.
Oh, yeah.
Even with a mask, it should probably be done. I mean, you can wash
Yeah.
them, but I mean,
Yeah.
what's the protocol for that is a whole other
We
policy.
get rid of all of them.
Yeah.
But yes, it's a whole other policy. Yeah, so looking at each of them a little more in depth, you know, a lot of school districts have standing orders for Tylenol and or ibuprofen. Part of it is the goal for kids not to self-carry and have a place in their self-care. There are other districts that have moved away from it because they have kids coming in constantly with headaches and the nurses start to feel like they're just, you know, popping pills. Even just those conversations with Dr. McDonald and what we want to do. You know, to me and my understanding, those all fit under the clinical decision-making. You know, we need a medical director to order that. But from a Board of Health perspective, we want to make sure that there is annual review of standing orders happening and that they're being distributed to everyone. So, yeah, it would be to get rid of all the minutia on a high level, not to us, about what's in the standing orders, and then just a policy that we have standing order review.
So you'd seek a motion to approve the standing orders policy as provided beneath the red language.
Do I have that?
A motion.
Do I have a second? Any opposed? All right, hearing none, carries. Thank you.
Okay, good, thanks.
Any other new business?
That is it.
We have a motion to adjourn. Second? All right, hearing no opposition, we are done. It is 8:27, sorry, hold on, 8:27.
Thank you.
Thank you.
A lot of
Thanks,
talking in my
everyone.
heart.